Hey there, amazing people. Welcome to Donut Dental. I'm Dr. Ganesh and I'm here to help you ace the CSCE OSCE exam. Let's get started. Community dental health and infection control. In the realm of dental hygiene, maintaining optimal oral health extends beyond just the individual patient. It encompasses the entire community and involves a multifaceted approach that includes preventive measures, infection control protocols, and a thorough understanding of classification systems used in dentistry. In this video, we'll explore the significance of community water fluoridation, the importance of hand hygiene and instrument sterilization, and the use of Naber's probe for assessing furcation involvement. We'll also delve into various classification systems used in dentistry, including Miller's Tooth Mobility Classification, G.V. Black's Classification of Carious Lesions, the AAP Classification of Periodontitis, and the Embrasure Classification. Community water fluoridation, a public health triumph. Community water fluoridation stands as one of the most effective public health measures in preventing tooth decay. By adjusting the fluoride concentration in public water supplies to an optimal level, typically 0.7 ppm parts per million, it provides a continuous and cost-effective way to strengthen tooth enamel and reduce the risk of cavities for the entire population. The Centers for Disease Control and Prevention (CDC) has recognized community water fluoridation as one of the 10 greatest public health achievements of the 20th century, highlighting its profound impact on oral health. The cost effectiveness of water fluoridation is remarkable, ranging from $0.12 to $1.16 per person per year. It's a wise investment as a lifetime of fluoridated water for an individual costs less than a single dental filling. The new recommended level of fluoride is 0.7 ppm, replacing the previous range of 0.7 to 1.2 ppm. In areas where the natural fluoride levels in water exceed 2 ppm, defluoridation is necessary to prevent excessive fluoride intake and potential dental fluorosis. Hand hygiene and instrument sterilization, the cornerstones of infection control. Maintaining impeccable hand hygiene and ensuring proper instrument sterilization are paramount in preventing the spread of infectious diseases in the dental setting. The CDC recommends washing hands for at least 15 seconds with soap and water or using an alcohol-based hand rub between patients. Hand sanitizers used in dental clinics should have a minimum alcohol concentration of 60% to effectively kill germs. Instrument processing involves a series of steps. Cleaning, removing debris and organic matter from instruments using an ultrasonic cleaner or manual scrubbing. Disinfection, reducing the number of microorganisms on instruments using chemical solutions or disinfectants. Sterilization, eliminating all forms of microbial life, including spores, using methods like steam autoclaves, dry heat ovens, or chemical vapor sterilizers. Steam autoclave moist heat, the most widely used method, utilizing high pressure steam to kill microorganisms. The standard parameters for steam sterilization are 121 to 135 degrees Celsius, 250 to 270 degrees Fahrenheit for a specific duration, depending on the type of autoclave and load. Dry heat oven, this method employs high temperatures 162 to 180 degrees Celsius or 320 to 375 degree Fahrenheit for a longer duration, 1 to 2 hours to achieve sterilization. It's suitable for heat stable instruments but not for those sensitive to high temperatures. Chemical vapor sterilizer. This method uses a heated chemical solution in a closed pressurized chamber at 135 degrees Celsius, 270 degrees Fahrenheit to sterilize instruments. It's less corrosive than steam sterilization but requires specific ventilation and handling precautions. Cold sterilization. This method involves immersing instruments in a sterilant or disinfectant solution for an extended period, typically up to 10 hours. It's suitable for heat-sensitive instruments but requires a longer processing time and careful monitoring of solution effectiveness. Naber's probe unveiling furcation involvement. Naber's probe, a specialized dental instrument with a curved design, is used to assess the presence and extent of furcation involvement in multi-rooted teeth. Furcation involvement occurs when periodontal disease progresses to the point of bone loss between the roots of a tooth. Classification systems in dentistry. Classification systems provide a standardized framework for diagnosing and categorizing various dental conditions, facilitating communication and treatment planning among dental professionals. Let's explore a few key systems. Miller's Tooth Mobility Classification. This system grades tooth mobility based on the horizontal and vertical displacement of a tooth in response to pressure. Class 0 Normal Mobility. Class 1 up to 1 mm horizontal displacement in a facial lingual direction. Class 2 1 to 2 mm horizontal displacement in a facial lingual direction. Class 3 greater than 2 mm horizontal displacement and or presence of vertical depression. G.V. Black's classification of carious lesions. This system categorizes cavities based on their location and the tooth surfaces involved. Class 1 cavities in pits and fissures on occlusal surfaces of molars and premolars, facial and lingual surfaces of molars, and lingual surfaces of maxillary incisors. Class 2 cavities on the proximal mesial or distal surfaces of premolars and molars. Class 3 cavities on the proximal surfaces of incisors and canines that do not involve the incisal edge. Class 4 cavities on the proximal surfaces of incisors or canines that involve the incisal edge. Class 5 cavities on the gingival third near the gum line of the facial or lingual surfaces of any tooth. Class 6 cavities on the incisal edges of anterior teeth and cusp tips of posterior teeth. AAP Classification of Periodontitis. This system stages periodontal disease based on the severity of attachment loss and bone destruction, along with other factors like tooth loss and furcation involvement. Stage 1 initial periodontitis with mild bone loss less than 15% and probing depths up to 4 mm. Clinical attachment loss scale of 1-2 mm. Stage 2 moderate periodontitis with bone loss of 15 to 33% and probing depths up to 5 mm. Clinical attachment loss of 3 to 4 mm. Stage 3 severe periodontitis with bone loss extending to the middle third of the root and beyond. Probing depths of 6 mm or more, clinical attachment loss of 5 mm or more, and possible tooth loss less than 4 teeth. May also involve furcation involvement class 2 or 3, tooth mobility degree 2 or 3. Stage 4 very severe periodontitis with extensive bone loss, potential for significant tooth loss 5 or more teeth, and compromised chewing function. May involve fewer than 20 remaining teeth. Furcation involvement class 2 or 3, tooth mobility degree 2 or 3, masticatory dysfunction, secondary occlusal trauma, severe ridge defects, bite collapse, drifting, flaring. In addition to staging, periodontitis is also graded to assess its rate of progression, responsiveness to therapy, and potential impact on systemic health. Grade a slow rate of progression. Grade B moderate rate of progression. Grade C rapid rate of progression. Embrasure Classification. This system categorizes the interdental spaces, embrasures between teeth based on the level of gingival tissue fill. Type 1. The interdental papilla fills the embrasure completely. Type 2. The interdental papilla partially fills the embrasure. Type 3. The interdental papilla is missing or minimal, resulting in an open embrasure. These classification systems are valuable tools for dental professionals, aiding in accurate diagnosis, treatment planning, and communication. By understanding these systems, you can better appreciate the complexities of oral health and the various factors that contribute to dental diseases. Conclusion. In this video, we've explored the broader aspects of dental hygiene encompassing community dental health, infection control, and classification systems. By understanding the importance of preventive measures like water fluoridation, maintaining strict infection control protocols, and utilizing tools like Naber's probe for accurate assessment, dental professionals can provide comprehensive care and contribute to the overall well-being of their patients and the community. Remember, dental hygiene is a dynamic field that requires continuous learning and adaptation. By staying informed about the latest advancements and best practices, you can ensure that you're providing the highest quality care and promoting optimal oral health for all. In our next video, we'll shift our focus to the fascinating world of occlusion and malocclusion, exploring the different types of bite relationships and their impact on oral function and aesthetics.